Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Welcome back to another episode of the Dental Implant Practices podcast. I'm your host, Philip Gordon, and today it's a great pleasure for me to be interviewing Dr. Siamak Abai. He is a 2004 graduate of Columbia Dental School, and he works as a team member for Glidewell Dental Laboratories. His role at Glidewell for the past 5 years has been as a clinician in their dental operatory, where he's involved with product development. He is also the director of clinical research and development and is usually involved with product testing. In addition to his work in the company, he also does some lectures and marketing for Glidewell. And on the side of that, he has a private practice of General Dentistry that he works in as well. So, Sia, I appreciate you taking some time out for me today. I know you're a busy man, and it sounds like you've got a lot going on. So why don't you give our listeners a little background of, after you graduated dental school, how did you get from, graduate to where you're at now in your career?
Sure. Well, first of all, thank you for having me. I really appreciate you also taking time to put together this great podcast. So my background was that I grew up in Southern California in Orange County, and that's where Glidewell Dental Laboratories is based out of. And when I was a kid, I would ride my bike up and down the street, and our street's Michelson, and it hits MacArthur, which is where the airport is, and Glidewell is right by the airport. So I would look at this building, this humongous building, and think, what is Glidewell Laboratories? And I didn't even realize that many years later I'd be working there and doing clinical research there. But from Irvine, from growing up there, I went to Columbia University for dental school, and I finished in 2004. And once I finished, I thought that I didn't have quite enough knowledge to jump into private practice. So I stayed and I did 2 years of advanced education in general dentistry. Once I completed that, that's when I came back to Southern California and I started practicing general dentistry. And of course, being in this area, there's a lot of demand for cosmetic dentistry. So I delved into that for 2 years before again realizing that I was hitting a ceiling of knowledge and abilities that I wanted to reach a little bit further up. So I applied for Prosthodontics, and I went to Harvard for my Prosthodontics degree, and that was in 2008. And by the time I finished in 2011, again, I've always wanted to live and practice in Southern California. So I decided to, again, come on back here. And that's when I became a little more familiar with Glidewell Dental Laboratories, and their needs really met my background. So I was able to provide clinical research for them. And we have an operatory there that we treat patients on a daily basis. And that's where I come in with my end of the work and the clinical practice that helps improve products and even helps kickstart some of the newer products that come out of Glidewell Dental Laboratories.
Yeah, that sounds fantastic. I'm actually, after hearing all of that, I'm kind of jealous. I always wish I maybe would have went to prosthodontic school, and I of course would love to have a lab and do all their testing and have a practice to implement all those, beta tests in and see what works and doesn't, have that kind of backing. I think that's every dentist's dream. So it sounds like you really landed in a great position. I know it's taken a lot of hard work to get there, and you guys are up to some great stuff. Why don't you tell the listeners who maybe are or aren't familiar with Glidewell? Obviously, you guys are a full-service lab. Tell everybody what's going on in the implant department. I know you've got a lot of balls moving. Let's just start with single tooth dentistry. I know you guys have the ability to do lots of types of restorations, and you also offer implants that doctors can buy and place and restore. So kind of walk me through what all you guys offer for, like a single implant.
Okay, so going back to probably around 2007, 2008, that's when Glidewell started their whole journey in implant dentistry. And it all started with developing an implant lab because of the need out in the market. So the inclusive abutments were launched, and Glidewell started providing custom abutment and final restorations for the consumer. And just a few years after that, Glidewell started producing their own implant system. So for the single tooth, really what we'll try to do is put together a package for clinicians where, because everything is so vertically integrated in the company, we can help the dentist save in costs so that they can get an implant, a custom abutment and final crown for about $400, for $399 or less. So we've tried to keep the quality as pure as possible and the process as pure as possible so that the general clinician can get their hands on more implants and treat more patients. And that's always been Jim Glidewell's philosophy, is trying to reduce the cost so that we can reach out to many more dentists, and eventually, of course, that translates into more care for the patients.
That's great. Now, is that the Bruxer bundle, or do you guys also have an Emax bundle? Does that depend? Do you have multiple types of crowns you can do? I mean, obviously that may change the price point.
Right. Yes, there is the Bruxer bundle, which would be either a mill titanium custom abutment and a zirconia crown, Bruxer crown, or a Bruxer screw-retained crown based on the angulation of the implant and where it's located and what the need is for that case. There are obviously different packages can be put together for different types of restorations. I know Emax is still very popular, and that's the choice of the clinician when they're requesting something from the laboratory.
Okay, great. So, kind of talk me through what else you have available. So, are there different types of implants? When you say there's an implant package, are there, like, what type of implant is that, and what type of implants does Glidewell offer at this point? I know I've heard of the hand implant. Are there other types, or is that kind of what you guys are pushing right now?
Well, we started out with the inclusive implant back in 2011, and my part of the clinical research has put out some really good numbers for that implant with in the high 90s success rate. And the inclusive implant is a tapered implant, and it has a hex connection similar to a Zimmer tapered screw vent implant. All right, just your standard tapered implant. In 2014, 2015, we brought along Dr. Jack Hahn, and Dr. Hahn, in collaboration with Glidewell Dental Laboratories, helped design the Hon Implant. It is a little bit different than the inclusive implant. It has a little bit more aggressive threading, and it also has a conical connection. It's still a hex, internal hex, but leading to that hex is a conical connection. So similar to a Nobel Active or a Nobel Replace conical connection type of implant. Now, the advantage with Glidewell has been the price point for these implants for the general population. I mean, when you go out and you want to treat a patient, and obviously with more dentists out there placing implants, the price of implant dentistry is going to come down a little bit, and the margins are going to get a little bit tighter. So what I've seen with a lot of my friends that are in private practice, they want a high value and they want the same quality. So that's what we've tried to develop with the Hon Implant. And actually it's become extremely popular in the field of implant dentistry, in particular with general dentists who are placing their own implants.
Yeah, great. I think that's great. Now the hand implant, or Hon, I guess, you say that's somewhat compatible with Nobel. If I've got a Nobel Active kit, can I interchange the components to screw in or place that implant?
If you have a Nobel Replace kit with the conical connection, you can. The drills for the Nobel Active kit are basically straight wall drills, and for the Nobel Replace conical connection kit, the drills are in the shape of the implant itself. And that's exactly how the Hon Implant is designed, so that we've seen that there's just less confusion with the practitioner if they have the final drill be the same shape and size of your implant. there is no question of how deep do I place it, how far, intraosseous does the drill have to go. And I think that's a little bit beneficial for the ease of use in that sense.
Yeah, I think you're right. I've got the active and the replace conical connection. I actually prefer the replace conical connection or the final drill being the exact shape, because I'm using this drill. It's shaped at the implant. The top of the drill stops where the top of the implant should go. So that's the same system that the Hon Implant has there. If I have a replace conical connection, I could buy 10 of the Hons and place those and not miss a beat. Is that what you're saying?
Absolutely, yes.
And then if I wanted to great. And then if I wanted to upgrade to your surgical and restorative sets, I could do so after that.
Oh yeah. And the good thing again with Glidewell is that with a certain number of implants, they will, just like a lot of other implant companies, they'll throw in the surgical and the prosthetic kit with the number of implants that are purchased.
Great. And with the Hon Implant, I know if I'm just going off no bill as a guide, it seems like there's a 3.0, which is your small or 3.0 diameter. Then you've got the red, which is like the 3.2 and the 3.5, which are the narrow platform. But I guess the narrow platform is 3.5, and the 4.3 even has the small. The narrow platform at the top. Is that correct?
That's correct. Yeah, the way that Dr. Hon designed it is that he wanted a bigger platform switch for the most used implant, the most utilized implant, which is the 4.3 diameter. And we've all seen the advantages of platform shifting. So having a bigger platform shift has given us a lot of good clinical results. And again, for simplicity and for the advantage of that, of platform shifting, we've taken the same platform for the two implants, for the narrow diameter and for the regular diameter implant.
Okay, great. And so
the 3.5 and the 4.3.
Yeah, and then you go up to a larger platform on the 5.0, and I guess you also offer a 7.0. Is that right?
That is correct.
Yeah,
yes.
Great. Now, what's your favorite implant to place at this time? I know you place and restore implants both. What are you placing more of in your practice, I guess, in Glidewell and in your private practice?
Well, I'm placing the Hon implants. I'm placing the most popular one within the Hon implant system is a 4.3 by 10 or 4.3 by 11.5. I think that's your standard implant. And I've placed the whole range of the 3.0s for lateral incisors, or for maxillary lateral incisors, or mandibular incisors, all the way up to the 7.0 implant. Obviously, a lot of care needs to be, you have to do your due diligence before placing some of these implants. Just because you're placing a narrower diameter implant doesn't mean that you're going to be safe from anatomical structures. So we're incorporating cone beam CT scanning and proper treatment planning in order to get the right outcomes. Even with the 7.0 implant, the advantage of that is you can place an implant that's shorter and wider, especially in the molar area, but you can't forget about the principles of having 1.5 millimeters to 2 millimeters of bone surrounding your implant when you place it. So I've been placing a ton of the Hon implants, and I've had some very, very nice results with them.
Great. Yeah, no, they seem like a great implant. I'm really excited to get my hands on one and place one coming up soon. So, I would agree. A 4.3 by 10 seems to be the most popular, just because you can almost kind of place it anywhere at times, and really restore it any way possible. So I think Glidewell really, and Dr. Hon really hit the nail on the head with that one. I think there's a lot to see there. Now, that implant has also been, I guess, now it's the official implant of the Misch Institute. Can you speak upon that relationship at all, and what you know about that? Because that's kind of a big deal.
It's a huge deal. It's a huge deal for both parties. And Dr. Misch, obviously, just one of the grandfathers of implant dentistry, and he's done amazing things for our field. And with the Misch Implant Institute, they've been teaching general dentists and specialists. And, I've been attending these courses, and I'm surprised how many oral surgeons, how many periodontists are actually in these courses. So I'm really surprised by that. It's great to have the combination of Dr. Hon and Dr. Mish together with their background in implant dentistry. And, a couple of years ago, Dr. Mish signed up with Glidewell. They partnered together, and then they moved forward to have the Hon Implant as the official implant of the Mish Implant Institute. And it's been a big success for both parties.
Yeah, I mean, I think when you merge two superpowers like that, only good things are going to happen. So I'm definitely excited to see where that continues to go. So, what advice do you have for general dentists that are either placing or restoring implants using your guys' products? What are the most common problems you guys see in the lab that general dentists are doing, or things that you say, hey, these are some quick take homes, either restoring implants and placing both? What could people kind of learn or benefit from your experience?
From my perspective, what I've seen is a lot of general dentists who are pushing their boundaries, which is great. And I think everybody should be on that path to improve their knowledge base and increase their skills and abilities and make more money with implant dentistry. We've seen some cases where implants are off angle. They're not in the right region for the proper restoration from the lab end of things. And as an instructor in some of these courses that we offer at Glidewell and through my lectures, I've just seen a lot of general dentists that instead of taking the baby steps in order to get to the point of, they feel comfortable placing the implants, they want to take great leaps and bounds. And it just doesn't work that way. What I usually recommend is you form some sort of a mentorship with a friend who's an oral surgeon, who's a periodontist, who's not threatened by you placing implants. And I don't think there should be a threat for any of the specialists out there, because there's going to be a need and demand as the market grows for all the specialties, including general dentistry, for implant dentistry. So form that partnership with the right specialist if you can. One way to do that is obviously sign up for a course that we teach at Glidewell, or sign up for a course that's given through the Mish Implant Institute, and automatically you have an instructor. And these courses, they're about anywhere between 40 to 80 attendees per course, but you still get that personal touch, personal instructions within that course, especially during the hands-on portion of them. So those help you take the baby steps. Signing up for these courses, or a continuum of courses as the Mish Implant Institute offers, you can learn a lot, and you can bring a case and say, hey, how would you do it? How would you treatment plan this case? And you can benefit a lot from that. We all know that implant dentistry, besides the fact that the treatment plan is difficult, the actual procedure, once you develop your skills and abilities, is pretty straightforward. You're reflecting the flap, you place an implant, and you close the flap back up. And the biology, the understanding of the biology has to be there for that type of work. And in my opinion, what I've seen is the challenges are with the treatment planning and not necessarily with the work itself. And again, I can't stress how important some of these courses are. And once you do take those baby steps with the continuums, the next step would be maybe you can partner with a university and take a 1-year continuum or 2-year implant dentistry continuum if you're very interested in becoming proficient at it, and going from there. So it's more of a lifelong learning type of scenario than it is, hey, I took this course and now I'm proficient and I can place implants and do full arch restorations on implants. It's a lot more than that, and there are a lot of intricacies in implant dentistry that you have to build into what you do on a regular basis when you're treating some of these patients.
Yeah, there's definitely a pathway that needs to be progressed through and respected. You got to learn to walk before you can fly, and so there's definitely things to look for. On that note, Glidewell teaches some courses. Can you speak about that? Where does somebody find out about these courses, and what type of courses are available? I know you said you might be involved with some of those. If I go to Glidewell Lab and look up, education, what's available there. I know there's lots of PDF guides and maybe videos, but what are some of the courses that I can attend?
Well, the courses range from how to place your first implant all the way through treatment of the dentulous patient, dentulous maxilla, dentulous mandible. And we have several different instructors that come in to teach these courses, including myself. I'm focused a lot more on the digital aspect of dentistry and implant dentistry in particular, with guided surgery and the accuracy of that, and really helping doctors take another step into the digital world as it's becoming a lot more popular. Now you can sign up for some of these courses, obviously through the Glidewell website, and there's a wide range, and we've tried to cover all the bases. We've also tried to bring on a sleep apnea team in order to help grow the general practice with that end of the education. So I think it's very beneficial. What we try to do is build a platform to help dentists succeed in their practices, and a lot of them have gotten a lot of feedback from dentists where I'll get emails or even phone calls, and they tell us how beneficial it was for their practice and to help build their confidence, because we do offer hands-on types of courses for implant dentistry, and now within this next year, we're launching a guided system, so we're going to be teaching courses on that as well.
Yeah, that's great. That's kind of what I was going to ask you about next. I do a lot of surgical guides, some of them pilot guides, some of them fully guided. Can you tell me right now, does Glidewell currently make surgical guides that can blend a CBCT and a model and help either make a pilot guide or a full full guided surgery guide right now?
Yeah, so I've been involved in-house with our team. We have a very very good team that's highly educated in the digital dentistry world. And for the past 4 years, we've been testing the accuracy of guided surgery and even the guides themselves. Just because you have a surgical guide doesn't mean that it's made to a high level where the guide is going to fit perfectly on the teeth and you can place the implant accurately. So we've been working on that for the past few years and improving our technique and our goals for the dentists out there is that we want to provide something that's very high quality. Now, that's what we've done in-house for the past 4 years, and we've also worked on developing a drill kit for guided surgery and what we can offer for the inclusive and the Hon Implant system. And we are actually planning to launch this system in 2017. So it's going to be a very exciting year for us.
Oh, great. So there's going to be a drill kit out and potentially the opportunity for you guys to make full surgical guides that are based off the CBCT. Is that correct?
Absolutely. Yeah, I didn't address that. What the clinician can do is send a intraoral scan and a cone CT scan of the patient. And we have a team at Glidewell that can put those together. They can merge the two different files and design where the implant should go. And through teleconferencing communication, they will sit together with the doctor online and show exactly where that implant is and get approval before fabricating that surgical guide. And this all ties back into the packages that are available from Glidewell, where you can get your implant and the custom dome and final crown within that package that includes the surgical guide along with that.
Yeah, that's great. I mean, that sounds like you guys are, looking at all the steps as they develop and helping tackle problems that, all the everybody's running into as as guided surgery is becoming better and better, it needs to be, in my opinion, incorporated on a daily basis with dentists placing implants.
Right. And, a company like Glidewell realized probably a long time ago that it's not just a restoration-driven company. We can survive and do very well and make a lot of money with just making restorations for doctors. But we want it to be a solution-driven company. And that shift I've seen happen within the past 5 or 6 years that I've been with the company. So we deliver solutions to doctors, and whether that's restorations, that's great. But solutions can also come in different forms, such as providing somebody with the education that they need to get a little bit more confidence to incorporate things into their own private practice.
Yeah, great. Now, maybe moving from the single unit to the multiple unit, talk with me and our listeners a little bit about the full arch prosthetics. I know you guys offer various applications for full arch implant restorative. What options do you have available? What options have you personally had experience using, and which ones are your favorite right now?
Okay, I'll start with what options are available. We have the whole range of options. So the most popular ones right now for the full arch are the hybrid type of restoration, which is a titanium substructure with basically denture teeth and acrylic that holds everything together. So that's what they call it, a hybrid. It's a very good restoration. It's an aesthetic type of restoration, and it was probably the most popular type of restoration for full arch cases, full arch fixed cases, I should say. Glidewell has taken an extra step with the Bruxer full arch prosthesis, where the entire restoration is fabricated out of one Bruxer block, and it's milled. And obviously, with milled restorations, the fit's going to be better than with something that's cast. Because of the whole casting process, you can incorporate some imperfections and the fabrication of the restoration. So the milled part of it is a huge advantage, and also the fact that it's milled out of one piece of zirconia, or one block of zirconia. It's monolithic, and it's stained, and then it's delivered. So there's no porcelain that goes on top of these restorations. Now, we've gone through thousands of these types of restorations, and we've put into place a system where we're constantly improving the aesthetics of the full arch restoration by testing out different types of staining and glazing techniques. And in my opinion, they've gotten to a point where they look very, very good. Okay, they're very aesthetic, especially if you're restoring the entire arch. You're not matching a translucent to a monolithic restoration, which was one of the big challenges with aesthetic dentistry. You're replacing all the teeth, so you're going to get that uniform look with these restorations, and they're also very strong. So one of the disadvantages with the hybrids were that the maintenance was an issue for dentists. The patient would come back and they fractured a tooth off of their hybrid restoration, and either the dentist had to remove this from the patient's mouth and send it back to the lab to have it fixed, or they would do it right then and there in the office, and then it was a recurrent thing. With what we've seen with the Bruxer full arch prosthesis is that the dentist doesn't have to fix it because there is virtually no breakage of these restorations.
Yeah, and I think that's what everybody wants if they're getting into a case this big, is to minimize the problems. And I don't want to be taking off full arch cases and repairing them any more than the patients want to deal with that. So I think that strength and beauty, I think, for that sort of case is what everyone's looking for. I've got a handful of cases that I'm in the process of getting ready to restore like that now, and I know I'm looking forward to giving you guys a try for that. What advice would you have to someone like me who says, I've got one of these cases and I've never done it with your lab before, but maybe I've done it before, or maybe they haven't. What what's a good way to do that? Because, you want to know who you're working with, and you want to have lots of communication. You want to do it right. I mean, would you call ahead and say, hey, I'm looking to do this case, talk with one of the lab techs, figure out what you need, and then every time you send information back and forth, have close communication with that lab tech, and is it going to be the same person working on it? How can you ensure that it's going to get done right for all parties, I guess?
Well, the Bruxer Full Arch Prosthesis department is a very tightly knit department. It's not the type of department where there are hundreds of people working on your restoration. So there are several people that are working, and you can have communication throughout the procedure. The secret for me has been to give them something that they can work with. A lot of times they get some cases that are extremely challenging, and now it's on the lab side of things to make it work. And you have to take a few steps back and say, okay, how can I make this more efficient for the lab to fabricate a restoration? So obviously implants in the right location, the right type of impression, things like that, and a clean impression that they can work with. Having a verified final impression or verified final working cast is the most important thing, especially early on in the procedure. So you have a verified cast, then having the correct bite registration and the correct teeth positioning. Those are going to be important as well. So there's certain things that the clinician can control from their end to get a better product out of the lab from the lab side of things. So I think it is a department where we can work closely with the doctors in private practice to get a very good quality product. We also work with ClearChoice with fabricating these Bruxer Full Arch restorations, and at the same thing, we're constantly in contact with ClearChoice on what they request from the laboratory. So yes, it definitely can be done.
Well, that's great. So do you guys have a close partnership with them, or is it something you guys are just doing on the side as needed?
Well, we do provide Bruxer Full Arch restorations for them. So it's a partnership in terms of a customer relationship type of partnership. Yes. Yeah,
that's great. So if you're doing a lot of their cases, I know you're doing a lot of cases. So I think that experience speaks volumes to that sort of thing, because this isn't something you want to do somebody's first case. You want a lab that's done thousands of these and knows all that.
Absolutely.
And like you said, it all comes down to correct implant placement, correct impressions, correct bite relation, putting the teeth in the right spot, and all that needs to be done ahead of time. So that's all planning and case selection and proper protocols before it even gets to the lab. So
right, and also having the mindset that there are no shortcuts. We're all looking for, how can I do this faster? How can I get this back to the patient quicker? You still have to go through a certain number of steps in order to deliver something that's acceptable for the dentist and the patient. And we have to be happy with what we deliver to the patients as well. So in my mind, you go through the right steps. You don't have to take any shortcuts. And that's when you can really achieve the predictable results that you're looking for.
Sure. Excellent. What other things are going on in the implant department or the implant restoration department, maybe that you have, information about that maybe I don't know to ask, or what's up and coming for Glidewell right now, or within your practice? Kind of share with me what you're up to these days when you're not just doing the busy work.
Well, in our department, obviously we've done a lot of work with our surgery kit. So, we're looking forward to launching that in the new year. And what that entails is getting the volume of cases in my departments, so treating more patients and testing out different parameters with General Dentistry. For example, we use a Objet Eden 500, which is a manufacturing type of stereolithography printer to fabricate these guides. In my opinion, it's one of the best printers out there in the market. And what we're working with is setting different parameters to see when we're fabricating these guides, at what increments of layering can we have a guide that's accurate enough to see on the teeth. So these printers work in microns and microns of printing. And at what level of microns can we set the printer so that the guide is printed properly and we can see it on the patient's teeth without having any rocking or without having it being held up. That's all on the internal side of things. So I guess a lot of people wouldn't have any insight on the type of work that we do internally with Glidewell. Besides that, we've been supporting a lot of different meetings and different organizations with helping general dentists place implants. A lot of the work is coming up with ICOI and AAID, and I'm looking forward to being there with Dr. Hon giving a lecture at the upcoming ICOI meeting in New Orleans in February. So that's going to be an exciting event for us. And on top of that, it's just we're going to have our working hats on and trying to improve the systems in order to help everybody out there with their cases.
Yeah, that's great. I know you guys are always up to something, and it's sometimes it's just taking what you're already doing and just making it better, faster, cheaper, and putting things in the hands of the dentist that they want faster. And so going back to the digital dentistry, obviously it's all heading that way, and you guys recognize that and do a great job. On the user end, what type of scanner do you see out there that you talked about scanning the patient's mouth and sending in the DICOM file for the CBCT.
Right.
In my opinion, scanners are still a little too expensive for them to be in every dental office in America, which in my opinion, they will be in 10 years. But when is that price point going to come down? Or have you guys thought about, making a relationship with a scanning company and trying to get them in more offices? Because I think that's still a big barrier for offices right now.
Right. And I think from what I've seen, the prices are coming down. I'm not partial to any scanner out there in the market. I think as long as you can scan an arch and be able to extract a STL file for digital communication, I think that's the most important thing. We've tested pretty much all scanners that are out in the market. We've tested them in-house, and they all fall within the range of accuracy that are more than acceptable when we compare them to a stone cast of an impression of the same patient. So we've done some testing in that sense. So the actual machine doesn't matter, and as you said, what matters for us practitioners is the price. We want the price to come down to a point where we're not spending $125,000 on a system. And we're locked in with that system, and we can't do anything outside of that. And what I mean by that is we want something that's more open source, where we can take out the STL file, hopefully ourselves, without going through that company that we just spent a lot of money with. And I don't blame the companies for trying to keep that a little bit locked in. They want to have a handle on their product, basically, and being able to control how many STL files you get. And some of these scanners are basically a pay-per-click type of situation where you have to pay every time you want to take an STL file. For me, I think the last time I checked, the 3M True Definition was one of the least expensive scanners out in the market. And you could have a open source type of scenario where you can take the STL file out and utilize it. The next wave is going to be cheaper scanners, less expensive scanners, and we have not delved into that in the recent past. But what I'm hoping is that we can get into supporting a scanning company in the near future. So that'll be very exciting for us to be able to provide.
Yeah, I agree. I think if anybody could just make a scanner and put it out on the market for $10,000, I think they'd sell 100,000 of them in the first quarter. I just think, I think every dentist wants to go that way, and but they're just not gonna. I don't want to go out and buy $150,000 Cerax so that I have to become my own lab person and justify that, because I don't like doing lab work. So I don't want to do that, and it's not open file. And then these scan-alone systems are still $45,000, and I just think, man, that's just a little outrageous for something that takes a picture and sends it through the internet. So I think if I had half a brain about technology, I'd start up a dental scanning company and get them on the market for $10,000 or $15,000, and I just think they'd go gangbusters. But
absolutely, and there's a lot of intellectual property issues that go along with that, and that's probably what's holding things back. A lot of these scanners have different modes of acquisition with the scanner heads and how they take the pictures. So there's only a certain number of ways that you can acquire the image, and I'm sure these companies don't want to give up any of that intellectual property or have somebody else replicate it. But once the patents open up, I think it's going to be a lot easier to move forward with developing a scanner. And you're right. I think $10,000 is a good price point. It's something that you're using to provide more efficient dentistry to the patient. Spending over $100,000, I think, is that's just out of bounds for a lot of dentists.
Is there anything you'd like to tell our listeners, either about the lab or things that you're doing, or best ways to get in touch with anyone in the implant department, or any other little nuggets of information that you feel like we haven't covered yet today?
Well, at the lab, we have an open door policy. So we'd love to have visitors. Usually we'll have doctors that want to come in and take a tour. And it's really an eye-opening experience. I mean, what you envision of Glidewell Dental Laboratories is probably completely different than what you actually will experience at the campus. And I call it a campus because it consists of 7 or 8 separate buildings, and different things go on in different sites. And the manufacturing end of what we do is really eye-opening. It's we manufacture implants, we manufacture Bruxer blocks, and more. So I think taking a course and going on a tour will be really beneficial for a lot of dentists that are interested on the implant side of things. Moving forward, I'm excited to work with a lot of different products and help launch different products with the laboratory, so that more people can utilize the advantages of Glidewell Dental Labs.
Yeah, that's great. I think the more I learn about your guys' company, I think the more impressed I am. So I think I'll try to make a special trip out to Southern California just to see the lab, and if I do, I'll be sure to let you know in advance and come see what you're doing out there. So
that'd be great. We'd love to have you.
Well, great. I appreciate your time here today. So we'll wrap up with that. And if there's any questions that anybody has about you, is there any way people can get a hold of you or call the company and see what you're doing?
Sure. They can either email me, and I will give you my email to post if that's okay.
Yeah, that'd be great.
Or they can call the company directly, and they can get in touch with me. Those are the 2 easiest ways. Email is probably the best form of communication, because I can get back right away with emails.
Well, great. Thanks for everything you're doing, and I hope you have a great 2017, and maybe we'll circle back here in 3 or 4 months and check in with you again, okay?
Absolutely. Looking forward to it, and thank you for having me. I really appreciate it.
Okay, thank you. Bye-bye.
All right, bye-bye.